A new poll shows that Obamacare is more popular than it's ever been. But the window to sign up for it slammed shut at midnight last night, maybe for good. By halfway through January, more than 8.8 million new people had enrolled. And in states across the country, huge efforts to get uninsured Americans access to federal health coverage continued up until the final hours.
This thing is so big.
I know.
Okay, get it centered. Right there. We're hoping to attract as many Georgians as we can who don't have any coverage and get them signed up before midnight tonight.
I've tried to do Medicaid, and I make too much for Medicaid. Yeah. I've tried it with me and my daughter on it, and it still is not.
Right. It's difficult to qualify for Medicaid. I'm going to take you to a navigator. They're going to take you through the process and help you decide, what would be best for you individually.
Your first name?
Gail, G-A-I-L.
If you get sick or have an accident, how worried are you that you will be able to pay your medical bills? Are you very worried, somewhat worried, or not at all worried?
Very worried.
So you are eligible for $212 in a tax credit, and you are eligible for lower co-payments, co-insurance, and deductibles as well. So the first plan that you're being offered is from Ambetter from Peach State. It is, the monthly premium is $16.75, and that's with your 212 credit applied. If you had not applied the credit, it would have cost you $228.75 a month. Wow. You have no charge for generic drugs, and then your specialist doctor visit would be $5.
I can go up higher on the premium.
Okay, well, here you go. $28 a month, zero deductible.
And I get everything that I need.
Yes, ma'am.
Wow.
I'm part-time at 2 jobs. I have a 4-year-old daughter, and I've been trying to find some way of getting insurance, dental or health or otherwise, and I figure it was a shot in the dark, but might as well try, and turns out I was able to get something. Part of me is worried that Trump is going to take it away, but if President Trump can still offer something that would be comparable, I would be all for it.
We are going through some changes and things are in flux, but right now, this is still the law. And the law still requires people to get health insurance. And think about it this way. Even though things are in flux in terms of our legislation, your health issues aren't going anywhere. There may not be any coverage for people with pre-existing conditions. That's scary. If you have cancer or lupus or diabetes and you have to go back. Absolutely. And then you got to go back to the system where you had to pay more money because of your conditions or even not have coverage at all. Right. That's scary.
Our role is to definitely allay those fears, clear up confusion, and make sure that they know that we're going to be here, because that's what we're here for. We're here to provide access, to help them get access to care.
And what would you say your expected 2017 income would be?
20,000.
Even?
Yes.
Okay. Okay. So it looks like based off the information you've given me, you would be eligible for a tax credit of $368 per month. All right, so do you want to go ahead and proceed with doing the application? Okay. So this amount right here would be applied to the premium. Emergency room care, there's no charge. Okay. Generic drugs, you would pay $1 for your generic drug prescription. Primary care doctor visit, $1.
I'm self-employed, and my business being real slow, and so my income just kind of went down a little bit. And so with this program, it's kind of helped everything level out for me. Well, I got qualified for the silver plan, and they had a big deduction on it, and so it's a big savings. So that was that was the best plan for me. I kind of feel confident that this gonna be okay, because a lot of things that he wanna change over, it's too many people that gonna be affected by it, and I don't think that's gonna take effect. I tell them if it ain't broke, don't fix it. It's not broke for me.